The dangerous link between coronavirus and obesity, the acute one, COVID-19, is swift and relentless, and it's disproportionately preying upon people affected by an even larger, more enduring pandemic, obesity. Obesity is a leading risk factor in mortality and morbidity from COVID-19. This speaks to a much larger deficiency within our society and our health care system today: the stubborn refusal to recognize and treat obesity as the chronic, deadly disease that it is. As we look to the future and begin planning for what the new normal looks like, both in society and health care, it's incumbent upon us to address the current deficits in our treatment of people with obesity. The growing evidence linking obesity to COVID-19 deaths. Based on the patterns we saw with H1N1 and obesity a decade ago, many physicians, myself among them, worried that obesity would prove to be a prevalent risk factor for mortality among COVID-19 patients. In study after study, obesity has been found to be a leading risk factor for mortality and morbidity from COVID-19 across the globe. In a study out of NYU, severe obesity (BMI greater than 40) was a greater risk factor for hospitalization among COVID-19 patients than heart failure, smoking status, diabetes, or chronic kidney disease. In China, in a small case series of critically ill COVID-19 patients, 88.24% of patients who died had obesity versus an obesity rate of 18.95% in survivors. The data on the repercussions of obesity in the setting of this global pandemic cannot be ignored. In the context of the pandemic, given what we now know about the increased mortality risk among people with obesity, this statistic is downright terrifying. The acute one, COVID-19, is swift and relentless, and it's disproportionately preying upon people affected by an even larger, more enduring pandemic, obesity. Clinical studies have supported the notion that obesity is a chronic disease for decades now. The World Health Organization was quick to warn that people with chronic disease were at increased risk from COVID-19, but it somehow left obesity off its list of pre-existing conditions likely to make patients more vulnerable. Likewise, when COVID-19 hit the United States, healthcare systems and medical professionals rushed to protect and isolate high-risk individuals, but people struggling with obesity were not included in these protective measures. The failure to protect people with obesity in our COVID-19 response plans mirrors our failure to protect these individuals within our healthcare system at large. While major medical institutions have teams devoted to tackling diabetes, heart failure, chronic kidney disease, and other life-threatening conditions, the clinical staff that addresses obesity tends to be on the periphery, rarely granted funding or taken seriously. Obesity represents an enduring global pandemic, but there's no vaccine on the horizon. Fighting obesity means waging a multifaceted war on a number of fronts, not just diet and lifestyle, but also with regard to environmental, psychological, medical, genetic, and microbiomic factors. COVID-19 has clearly revealed that obesity, independent of its associated diseases, kills. It's time for our society and our health care system to devote the same amount of resources toward medical obesity treatment as it does toward diabetes and heart disease. To continue ignoring the mounting evidence of obesity's deadly toll before, during, and after the COVID-19 outbreak will be to continue ignoring the most costly pandemic in human history. Thanks for watching. Please do like, share, and subscribe.